Hi, my name is Morgan Clark, and this is my capstone presentation. Before we get started, I just want you to imagine someone you love, a parent, grandparent, a neighbor, slowly becoming isolated, mistreated, or financially drained by someone they trust. And now imagine that it happens silently without anyone noticing until it's too late. In Nebraska alone, thousands of older adults experience abuse every year, and the majority of cases are never reported. Today, I want to show how awareness, action, and effective communication can help prevent elder abuse and protect some of the most vulnerable members of our community. Today, I'll be talking about elder abuse in Nebraska, what it is, who it affects, why it often goes unreported, and how we can make a difference. Elder abuse can take many forms, including physical abuse, emotional abuse, financial exploitation, neglect, and abandonment. Older adults are especially vulnerable due to physical limitations, cognitive decline, social isolation, and dependence on caregivers. The scope of the problem in Nebraska is significant. In 2022, Adult Protective Services investigated 3,502 cases of elder abuse. That was a 53% increase since 2018. Additionally, 17.2% of Nebraskans are 65 or older, meaning a substantial portion of our population could be at risk. I chose this topic because elder abuse is a serious but often hidden public health issue. It is very close to my heart because I've had grandparents who lived in nursing homes, and I would never want them to be mistreated. I also work in long-term care, and I treat each resident as if they were my own family because families put their faith into us to care for their loved ones. Unfortunately, many cases go unnoticed until severe harm occurs. By learning to recognize the signs and applying effective communication strategies, we can all play a key role in safeguarding our older population. Early in my healthcare career, I experienced conflict with coworkers because of my direct and assertive communication style. They oftentimes didn't want to work with me or help me at all. I realized that my approach could unintentionally escalate tension in the workplace. Over time, I learned that effective communication isn't just about being honest, it's about balancing honesty with compassion, active listening, and validating others' feelings. Collaborating on solutions fosters stronger relationships and a healthier work environment. These communication skills are directly relevant to addressing elder abuse. Clear, empathetic communication helps to build trust with older adults and their families, encourages them to share concerns, and ensures that potential abuse is reported and addressed appropriately. During my preceptorship in the emergency room, I was responsible for providing concise, evidence-based updates to my physicians using the SBAR format. Initially, this was really intimidating. I was expected to not only report facts, but also to integrate my clinical reasoning and judgment. Through practice, I learned to prioritize critical information, communicate confidently, and maintain a professional presence through clear speech and active listening. These skills are essential when addressing elder abuse. Structured and confident communication allows me to report suspected abuse clearly, ensuring that healthcare teams and authorities take concerns seriously and intervene appropriately. In this next situation, I was working as a medication aide in the long-term care facility that I'm employed at. I was doing my med pass and doing my 3 checks and discovered that a resident in previous shifts had received 3 times the prescribed dose of Lasix without any sort of potassium replacement. This was a serious risk to this resident's health, and so I ended up reporting it to the nurse, and we watched the resident really closely. Reflecting on this event taught me the importance of vigilance, attention to detail, and accountability. Even small lapses in judgment can have significant consequences, and reflection helps me improve patient safety and professional practice. In regards to elder abuse, reflective practice allows healthcare providers to recognize neglect or unsafe care, report concerns promptly, and advocate for vulnerable adults to before harm occurs. Then over the summer, I was in the ICU for clinicals. This was really overwhelming for me because these patients are so sick and so critical. So initially, I focused mainly on the physical assessment data, but over time, I realized that I needed to view patients holistically, considering not just physiological factors, but also psychological, emotional, and social components. By creating concept maps, I strengthened my critical thinking, clinical reasoning, and interdisciplinary collaboration. This reflective whole person approach ensured that patient care was comprehensive and patient centered. When addressing elder abuse, this perspective is invaluable. Considering the full context of an older adult's life allows me to detect subtle signs of neglect or mistreatment and advocate for interventions that are ethical, compassionate, and tailored to their needs. Working with patients from diverse cultural backgrounds challenged me to confront my own biases, including assumptions about gender and culture. When I was working in oncology, I had a patient who came all the way from Saudi Arabia for cancer treatment. This patient didn't speak any English, and the situation revealed fear-based assumptions that I hadn't really realized that I had. I could feel myself getting anxious when I would have to go into the room, but I learned that being a change agent means actively challenging personal biases, stepping out of my comfort zone, and engaging respectfully with patients to model inclusive behavior and promote understanding. These lessons are directly applicable to elder abuse because cultural awareness and sympathy help me build trust with older adults from diverse backgrounds, recognize signs of abuse that may be influenced by cultural or family dynamics, and advocate for their safety in a respectful and ethical way. In this next situation, it was my first year of nursing school. I was in a rehab facility and I found a resident on the floor, so I went to get the nurse. And without assessing this patient at all, she picked her up off of the floor and kind of almost dragged her to the toilet. And then she turned to me and told me to not say anything to anybody because she didn't want to do the assessment. And if I didn't say anything, she would let me perform whatever skills I wanted to do. As a new nursing student, I was anxious and wanted to do all of the things to maximize on my learning. And so this felt really challenging for me, but I knew in my heart that I had to say something. So I chose to report the incident to my instructor, and then I addressed it directly with the nurse. This experience taught me that being a change agent requires courage, integrity, professional judgment, and action, even in challenging situations. Speaking up and documenting concerns appropriately can create meaningful change. In the context of elder abuse, these principles are crucial. Recognizing unsafe practices, reporting concerns, and advocating for vulnerable seniors ensures their safety and promotes ethical, high-quality care. By acting with integrity, healthcare providers can influence the environment to protect older adults and prevent harm. Elder abuse is preventable, but only if we recognize it, report it, and support the victims. Each of us has a role to play in protecting Nebraska's older adults, whether as professionals, caregivers, family members, or neighbors. By applying communication skills and staying vigilant, we can make a meaningful difference. Thank you for your attention, and I encourage all of you to speak up, listen closely, and act to protect our elders. And here are my references.